action.
Okay, I'm going to demonstrate some lymph drainage massage on Sarah's leg here. One thing I'd say about lymph drainage is that it's important to clear the pathway for the fluid to get to a chain of nodes that runs along the centre of the body. So I'm going to work as if Sarah has some fluid retention in her knee or potentially in her ankle, but what I'll be doing is clearing the pathway all the way up towards her navel. As Andy showed you in the previous film, we know how to find the correct level of depth in our pressure. So it's not skin and it's not muscle, it's somewhere in between. And I'm going to start just here around Sarah's hip. And there's a node just in here. So I'm just going to start by sinking my body and adding some gentle pressure using the side of my hand. And just start clearing the pathway towards the navel. And it's important to stay focused on the fluid that you're moving. It might be tempting to want to investigate in other muscles and other things that you pick up. Okay. And I'll move down to the inside of the leg. You can see the ripple appearing, so I know that I'm at the right level of depth. And it's tempting to start speeding up. It's a very slow, very relaxing massage. Just keep the right pace. Working this lymph fluid up to where I started at one of the lymph nodes just by Sarah's hip. And you can imagine that we're bringing the fluid up here where it will start to pool. And this time I'm going to know that I'll be bringing some more fluid up to that node, and then I'll carry on up towards the navel, so clearing that passage completely. To go collect the pool of fluid that I've brought up already and continue up towards the navel, towards that chain of nodes through the centre of the body. It's also good to stimulate the nodes by doing just some slightly harder pressure and focused just on the nodes themselves. That stimulates them to start working and free up any congestion. much further down, working on the leg. And what you can do is you can use the foot as a pump to help move things along. So I've got a pillow underneath Sarah's foot here, and that just helps the flow. So gravity's on our side. It's nice and comfortable for Sarah as well. So I can start as far back as the foot. And this time I'm going to do the whole length of the leg all the way up, just to finish off. We cleared the pathway earlier with the strokes from the knee up to the nose, and now I'm just carrying all the way through. I'm going to sweep up that pool of fluid that's been stimulated and carry on up towards the navel.